Hi, hello everybody.
Hello.
Hello, let me introduce. This is Dr. Jane Yeung. She is the honor clinical professor from Hong Kong, Chinese U. She has been practiced over 15 years to various Hong Kong government hospital and did many lecture and trained a lot of family medicine doctor. She specialized on really on the eye. So today we're very honored to have her actually talk to us regarding introducing of diabetic eye disease, which is very rare actually in Hong Kong. You could find a doctor provide this very informative webinar. So we're very honored at that. 各位朋友今日好高興咧，有機會咧係能夠揾到楊真真醫生咧，係幫助我哋講呢個糖尿患病者嘅眼。其實好多人咧唔知道咧，糖尿眼咧好多人都有，依家講翻俾你聽，你都卡咗呢條，原來我都有機會變咗係糖尿眼嘅。咁佢今日咧係特別幫助我哋咧係能夠多啲了解咩叫糖尿眼。咁因為情況下咧，我哋就因為呢個都幾深奧啦，咁我就唔想阻太多時間，但係好 honor 今日咧真係俾到楊真真醫生咧係講到我哋嘅即係糖尿眼係咩嘅問題，同埋咧係醫治係點樣，同埋點樣去 final examine 呢樣嘢嘅。咁I'm so honored to have really field professor of Dr. Jane Yeung also able to provide us the detail of what is diabetic eye. So we will, without further ado, we will basically start the presentation, and Dr. Yeung is going to speak English. I am going to speak Chinese. Okay. Now, if area that I cannot translate, I will switch over. So anyway, this is going to start off, and we'll leave the question all the way to the end. Now, I know a lot of people cannot get in, no problem. What we're going to do is you can make sure to see us in Facebook Live in either Lowsutea or the area is called CTT. So both live and Facebook page, you can see it. So and that will be how we're going to make this seminar. 各位睇唔到咧，唔緊要，你入唔到嚟咧，我哋咧就會喺Facebook Live 嗰度咧，亦都睇到我哋嘅。所以變咗嗱，首先各位堂友或者朋友啦，因為我哋好多人都喺 Facebook Live 睇到啦，咁你可唔可以首先咧喺 Facebook Live 嗰度咧俾個一字我先，一寫一字，俾個唔係俾個 like 我喺 Facebook Live 俾個 like， 俾個 like 我得唔得？咁變咗俾個 like 我俾個 like 我。咁我知道你係能夠睇到你啲你嘅東西嘅，俾個 like 介大家俾個 like 我啦，喺個 Facebook Live 嗰度嚇，唔該晒。咁喺 Zoom 嗰度咧，亦都俾個一字你聽到我講 ，OK？ So matter of fact, Eugene Yeung from Honolulu say hi to you. Anyway, hi. Today we have people from Hawaii, we have people from Australia, people from Singapore, people from Philippines, people from Hong Kong. People from Chicago, not Chicago, but Los Angeles, also people from Vancouver. So it's a really multinational place to get this webinar going. So it's okay. So anyway, we will start off now, and I will bring the slide over, and so we can able to start going with this webinar. Okay. So let's do that then. Okay, hold on. Okay. So now you can start off. Okay.
Right.
They can see that now. You'll be okay.
Okay.
Okay. Good. So.
Hello everyone. Good afternoon. Nice day in Hong Kong. I hope it's equally nice where you are. So I'm Jane Yeung, and so we'll do a short introduction of diabetic eye disease today. I hope I won't bore you too much.
I think it will be a very exciting lecture because you know why? Is one lecture, even though I'm an ICU nurse, for eye, I'm not that familiarized. I can know all about other diabetic disease like kidney dialysis, everything, but eye is one subject that we are not that familiarized. So very honored to have Dr. Yeung to able to provide that knowledge to us so we know how to prevent that.
Right. Okay, let's start. Okay. All right. Okay. Okay, so the disclosure, nothing to disclose actually, no financial interest. And diabetes, I'm sure you heard and you've known some people with diabetes. So the common symptoms like dry mouth, you lose weight, you go to toilet often to pass urine, and then to confirm it, you need investigation. So a lot of people have diabetes. So, and in fact, it is a.
Let me just go for a slide translate slide. Yeah， 嗱，各位堂友啊，記住咧，因為我哋亦都講咗好多書啦。咁當然啦，第一咩叫做糖尿眼先？糖尿眼咧，好多人咧就原來知道咧，就第一佢會變咗係有依個即係乾口啦，即係口乾啦，或者忽然間嗰啲失咗好多磅啦，仲有咧就成日去洗嗰間啦，仲有好多 sign 咧，就譬如好似你一定要驗血先知道啦。我有2、3堂都講咩叫 A1C 啦，記唔記得啊？咁所以其實咧，我哋依家講好多嘢都係喺呢方面咧，大家都有聽過好多次㗎啦。但係唔緊要，繼續了解，因為咧其實咧 A1C 咧就所有醫生都 base on 你 A1C 係講即係你個係咪你嘅血糖點樣嘅。
Right, so diabetes is we call it systemic disease. It affects a lot of the organs of the body, and then mainly because of vascular complications.
嗱，糖尿病咧，其實咧你知道啦，我都講咗啦，係全身都係能夠影響嘅。你所有嘅血管，所有嘅都係影響到你全身血管，所以係全身嘅病嚟嘅。其實應該講係全身血管病。咁所以其實一個糖尿病，如果你唔去注重咧，係真係會一個第時好大嘅問題嘅。
Okay, let's go. So for eye disease, eye disease common symptoms like blurred vision. But apart from blurred vision, people can also complain of like double vision, if they have eye pain, eye discomfort. And what's the cause of that? So we need to do examination and in some cases do some specific investigations.
嗱，其實糖尿首先咩叫眼病咧？糖尿眼病咧，好多時咧就開始第一個咧就係個眼開始蒙啊，同埋或者有兩個即係好似 off focus 或者睇兩件嘢咁嘅。咁其實呢樣嘢咧，亦都有眼痛啦，同埋仲有一樣嘢咧，好多時咧就要去個醫生檢驗嘅時候咧，就揾呢個情況係點解啦。咁其實咧唔好諗住個糖尿病，我就3年糖尿，因為啱啱就有個即係有個patient 咧，有個即係糖友啦，係飲膠類嘅茶咧，佢已經有糖尿病，因為3年嘅啫，佢已經話我就眼蒙啦，睇唔到嘢啦。咁其實有好多依啲嘅，所以要小心呢樣嘢。
咁所以我哋 all right switch channel. So blurred vision, what is blurred vision? In fact, it can be everything blurry. Can be like a washout or fade out, or it can be patchy blurry like the diagrams below, that you can lose part of your vision or you can see things distorted. These are some description of so-called blurred vision or impaired vision.
如果你係視膜模糊咧，原來有4種嘅。第一，真係好似影相，影相 off focus 咗模糊晒嘅。另外啲顏色咧，好似唔對擺，淺咗色嘅，或者好似全部白賴咁。咁第三個咧，仲有好多咧係一點黑一點白，即係全部黑咗一啲地方，咁啊睇得唔清楚嘅。有一啲真係全冇咗嘅。咁仲有咧就好似人哋即係睇電影咁，有啲line 啊，全部都即係歪咗嘅。咁有呢4個影像咧。其實就係知道咧，你係有一個視膜模糊嘅情況出現啦。
All right, so before I talk further about the disease, let's talk about the anatomy.
我哋未講呢個症狀之前咧，我哋首先咧就講講我哋嘅隻眼嘅結構係點樣啦。咁我哋亦都了解眼嘅結構係如何嘅。
So there's a diagram of the eye, kindly provided by my colleague, and so it shows the eyes are actually eyeball. It's like a ball, and the front part of the eye, and then the lens, and then the inner part of the eye.
嗱，其實咧呢個眼嘅結構好似真係一個球咁嘅。咁當然啦，就有個眼嘅lens 啦，即係一個好似相機咁啦。然後眼裏邊嘅結構咧，就其實裏邊就有細胞同埋嗰啲視網嘅nerve 啦，即係嘅係啊。咁所以變咗係一個眼球，即係一個波咁嘅。
So basically the eye is to focus, to let us see. So the vision is to receive signals from the outside. Light travels into the eye, and then through a focusing mechanism, and so to put this energy on the retina.
OK， 嗱，其實眼咧就出邊你睇到嘢啦，咁入嚟咧就 go through 你個 lens 啦，嗰個眼膜啦，然後就睇落去咧就去到個 optic nerve 後邊咧就 interpret 你啲睇嘅東西，咁就好似一個相機咁嘅喎，其實呢個。
So we'll use the analogy of a camera. So actually the camera copies the eye.
OK。
Or tries to copy the eye.
嗱，其實咧就相機嘅做嘢方式咧，同即係隻眼嘅模型都係一樣喎。可以講嚟為即係你影相嘅相機講完之後，即係睇住眼係點做咧，就跟住嚟做一個相機一樣嘅原理嘅啫。
So the camera has many parts, okay, and so this camera dismantled. So we look at specific parts of the camera, and then we'll put it as an analogy to the eye.
咁嗱，其實咧呢個咧就用咗相機個模型出嚟咧，咁等你更加好似了解咧隻眼係點嘅。你可以睇到咧前面咧就有個鏡頭啦，然後後邊咧就我哋可以講嚟個 optic nerve 喺度啦，咁都係好似咁上下嘢嘅。
So this lens, as Andrew just said, is a lens of a camera.
咁呢個咧就好似個眼嘅鏡頭啦。
So it's corresponding to this part. Okay, this part.
OK， 咁就好似個晶片咧，好似喺前面個眼球嗰度啦。
So when we look at the eye, this is a dilated pupil. So we can see a lens inside. And then, in fact, this case, the lens is already opacified. You see, it's not clear. So this is a cataract.
OK， 嗱，其實咧睇到呢個咧，我哋開始咧就睇睇第一呢個就眼嘅即係個晶片啦。咁然後咧喺裏邊咧就睇到真係個晶片咁啦。但係呢個晶片咧好特別，已經朦朦地嘅，因為佢呢個晶片已經有個白內障嘅情況出現㗎啦。
So then we look at the other part of the camera, the important part. Nowadays it's a CMOS, but in the older days it will be the film. 菲林係of the camera.
Okay, the good old days, this part was supposed with the film, which you capture all the image, but now suddenly is a light
panel.
Yeah, it's a light panel which has cells that capture the lens to interpret into computer's lens. But naturally, this is the camera. But on the other hand, in human here, this is the nerve to capture the information.
Actually, this is retina.
Retina, yeah.
The nerve is the cable.
Oh, yeah. Okay,
nerve
retina.
Retina is the film.
Yeah, the film. Okay.
So there's a picture of the retina. So there's normal looking retina. And so it's orange. You see the vessels, the branching normally.
嗱，其實咧喺隻眼裏邊咧，最重要咧就係個視覺膜 retina 就係個視覺膜。咁個視覺膜咧裏邊咧就有不同嘅好多血管帶入去個視覺膜嗰度嘅。咁其實呢個就係最重要。咁所以醫生睇咧好多時咧就睇呢個叫視覺膜係點樣嘅。裏邊有冇啲好嘅東西？好似個視覺膜有個 optic disc 咧，即係視盤啊嗰啲東西啦，同埋仲有冇其他有不同嘅不同嘅唔好嘢？應該就會再講俾你聽嘅。
So yes, this is a normal picture of the retina. So we look at the color, we look at the vessels, we call it the optic disc, which is the beginning of the optic nerve. The nerve will bring signals to the brain. So this is the nerve, and then for a particular part of the retina, actually it's a 5 mm diameter area of the retina. We give it a name. We call this part the macula.
嗱，其實咧，我哋喺個視覺膜裏邊咧，
視網膜，
視網膜裏邊咧，咁我哋就揾一笪地方，大概5毫米，即係5 mm 啦。咁佢呢笪地方我就叫 macula， 叫黃斑。
So the macula is important because it is the part of the retina we use for central vision.
其實呢個咧 macula 呢個黃斑呢個咁重要咧，呢個睇嘢嘅時候咧，我集中上去睇咧，都係由呢度睇出嚟嘅。
So we go on.
Yeah.
So this is another drawing showing that light will come into the eye through the lens is focused on the retina.
OK 嗱，咁呢個係另外一個睇嘅方式啦。咁如果嘢睇入嚟嘅時候咧，就 go through 個晶片啦，即係你個 lens 啦，即係好似相機咁樣啦。然後射入去咧就係個 retina 嗰度啦，即係頭先嗰個視網膜啦。咁嗰裏邊咧就係睇到嘢之後咧，就睇到晒個視網膜裏邊嘅東西。好似你譬如睇個 E 字咁，就喺嗰度喺個 interpret 出嚟㗎。嗰個就係5個 mm 嘅東西。
So we need to talk a little bit about this part, okay? The eye is a ball shape and it has a certain pressure within it, otherwise it will collapse. So what is causing the pressure is in fact there's a circulation of fluid within the eye. We call the fluid aqueous, and this is a flow of the aqueous within the eye.
OK， 其實眼裏邊嚟講咧，就係有好多啲水喺裏邊嘅。咁個水咧係 support 咗成隻眼咧。如果冇咗啲水，眼會 collapse 㗎，你知啊？咁所以咧，裏邊咧嗰啲水咧就係喺個周圍個 lens 個係喺度游嚟游去嘅。咁令到即係個眼裏邊咧就有即係壓力啦。咁令到能夠即係 hold 住成個眼球，唔會即係變咗 collapse 啦。
Carry on. So apart from one eye is so complex. We have two eyes.
嗱，我唔記得人咧，我係2隻眼嘅。咁頭先講嘅係1隻眼啫，第2隻眼都係一樣嘅。咁其實2隻眼都係一樣咁同樣做法。
And then when two eyes, sometimes things can get very complicated, especially the information from each eye will go through the nerve and the brain, and eventually the brain help us to interpret what we see.
嗱，隻眼記住我呢有2隻眼㗎嘛，眼睇之後咧，佢就上嗰啲文件，好似電腦咁啦，有條電線入咗去個腦嗰度咧，個腦咧就 interpret 睇啲係點樣嘅。咁所以變咗就一個係好即係完美嘅東西啦。讓你對隻眼睇之後，嗰啲 signal 就去隻腦嗰度就係話俾你聽睇咗咩啊。
All right, so I won't bore you with more anatomy, and then let's go back to the topic.
嗱，我哋就或者唔好講得咁太深奧啦。咁我依家就講下最重要嘅眼嘅疾病係點樣啦。不過你都要知道點解會有咁嘅東西，你先能夠有了解隻眼係點樣，係咪？
So knowing some parts of the eye will help you understand the disease.
嗱，因為講咗呢咁多嘢咧，我如果講翻依家用糖尿眼係點樣咧？當講咗之後咧，你就會了解咩叫糖尿眼啦。
So some of the eye diseases are particularly linked with diabetes.
嗱，你知道啦，糖尿病唔係淨係佢有啊，其他嘅眼嘅疾病都可以做到好似唔似糖啦，但係都有不同嘅疾病出嚟啦。咁今日我亦都可以趁呢個方法咧係解釋下。
So we show with more examples.
或者我用多啲嘅例子嚟解釋俾你聽，咁你就多了解啦。
So this is a picture showing patient's two eyes, okay, that in her case, one nerve that controls the extraocular muscle is affected. So there's inflammation of the nerve, and then that's why one eye, in fact, the left eye, could not move normally, could not move outwards.
OK， 嗱，想講講咧，有啲疾病係咩嘢咧？譬如你隻眼，你個神經系統，尤其是第6神經係發咗炎、腫咗， 咁你隻眼咧係轉唔到左啊右嘅。咁變咗嚟講咧，好似呢個病人講，隻眼係應該係可以轉右嘅，但係一隻眼唔轉喎，你睇唔到啊？咁佢唯有咧就只係睇到嘢，咁個問題咧佢就睇咗重影㗎啦。
Yeah, because the two eyes don't move together. So this is one form of diabetes that can affect the eyes. It's not directly affecting the eye, but the muscles cannot move the eyeball.
OK， 嗱呢個咧係有啲糖尿患病者咧係有呢個情況發生嘅。咁佢其實咧就唔係真係隻眼嘅問題，但係佢發炎咧就係喺佢個眼嘅神經線度發炎，咁令到咧佢隻眼咧左邊右手邊隻眼就唔喐啊，肌肉唔喐啊，咁佢令到眼唔喐嘅時候咧，佢眼係睇唔到，即係喐唔到嘅，咁佢睇嘢全部都係重影嘅。
So and then another example directly related to diabetes may or may not, but cataract is commonly seen in diabetic patients.
嗱，仲有一個係常見嘅眼嘅糖尿病嘅眼嘅疾病咧，就白內障。嗱，當然咧唔係個個白內障都係糖尿病，但係好多白內障係關於糖尿嘅。
So this is picture showing. I don't know if it's showing your computer, but there are some abnormal vessels on the iris.
嗱，因為你喺個電腦嗰度未必睇得清楚啦，但唔緊要，喺呢個或者係電話都應該睇到嘅。咁但係其實咧就係呢個糖尿眼裏邊咧好多眼嘅唔正常嘅血管咧彈咗出嚟，紅膜啊彈晒出嚟嘅。咁變咗嚟講，呢個咧係對呢個病人咧就有一個可能叫做青光眼係咪？多數叫做青光眼就係咁樣做出嚟。
So this patient has glaucoma due to these abnormal vessels on the iris and affecting the circulation of the fluid within the eye, and the intraocular pressure is raised.
係 ，yeah.
Go back.
糖尿眼咧如果有青光眼咧係一個好大問題嘅，因為個問題咧佢個裏邊你見到我個眼裏邊好多水㗎係咪啊？呢度如果唔係咧就會 collapse 㗎嘛。咁呢裏邊咧第一佢裏邊嗰啲血管咧就生得好多好多。第二，亦都會有好多嘅好似John the Zoom signal is not good. Make present slide like OK 我講先啊。咁變咗嚟講咧，令到嗰個可以見到嗰個眼咧就變咗咧係青光眼啦，同埋裏邊嘅水咧即係裏邊嗰運得唔暢順啦，咁原來個眼球咧個血管就好高啦。OK。
Can all of you see our slides?
Now somebody cannot see a slide. Probably is not due to us. Due to probably in your Philippine area, the actual the website. Your internet connection not so good. So I would suggest you try to see it through your Facebook. Maybe at that time it will be better. The people in Hawaii, in Hong Kong, can you give me a 1 so that is you can see well? Hong Kong, Hawaii, can you give me a 1? You can see the slides, okay? Eugene, can you help me give me a 1?
Yeah.
Okay, so Hong Kong is good. Only Philippines is not so good. Is it Hong Kong? Okay, Alex Wall. Okay, good. I saw a lot of Hong Kong people say yes, and Hawaii is good. Okay, Singapore, can you give me some number? Anyway, okay, I think the Philippines are having some problem because of internet. But if you cannot see, maybe try Facebook. I think there might be a better connection. Okay, go ahead. Please.
All right, continue. Okay. So there's a picture showing that the optic nerve is abnormal. It's swollen. The optic disc, okay, we call it optic nerve head, same part. That is inflammation of the nerve.
OK， 嗱好多糖尿嘅朋友咧，亦都佢有個神經系統咧，叫 optic nerve， 即係睇嘢嗰個視覺神經係視覺神經嘅嗰個頭嗰度咧，發咗炎啊。咁腫咗之後咧，咁佢就睇嘢咧就係唔會睇得好噶啦。 因為佢係有發炎喺度。咁呢個就睇到嗰度咧喺個 optic nerve 嗰度咧，即係神經嗰個視覺神經嗰度咧係腫咗啊。
So then we will come to something a lot of people know that it's diabetic. DM stands for diabetes mellitus. So diabetic retinopathy.
OK， 另外一個多數好多人都聽講過咧，就係 diabetic retinopathy， 即係話糖尿病視網膜病變啊！依個咧就係好多你哋喺見到醫生啊都會聽到呢個病嘅。咁呢個就係常見到嘅病啦，呢個就。
So if it is very severe, DM, diabetic retinopathy, it can cause retinal detachment. So in this picture, this part, the left side of the picture is abnormal. This shows a detached retina.
OK， 咁咧就好，如果真係一路差落去嘅時候咧，好多時咧嗰個視網膜咧成變到咧脫落咗啊！咁你睇嘢就睇唔到㗎啦。
So advanced diabetic eye disease is a potentially blinding disease.
嗱，其實咧仲有一樣嘢咧，如果你係嚴重嘅糖尿病嘅問題咧，咁其實咧係一個即係失眼明嘅病嚟嘅，可以講為，因為你如果控制唔到你糖尿眼咧，最後咧就失明。
So routine screening is important for early identification and prevention of the development of the advanced disease.
所以咧，其實好重要咧，就一定要有早啲長期嘅定期去檢驗你個眼。如果你眼係繼續檢驗嘅時候，就好快知道係咪有問題，咁你就即刻揾醫生處理啦。
And to have diabetic eye disease can affect our own self-care, and diabetic patients may have problems in taking care of themselves or in monitoring their diabetes control.
嗱，其實咧一個好大問題咧，當你有糖尿眼咧，其實影響你自己點照顧自己嘅，因為咧你係左邊就睇蒙晒啦，或者睇嘢好似曲曲辣辣咁，變咗好似個電腦壞壞地咁樣，或者睇嘢應該紅燈嘅，你睇綠燈，即係呢樣嘢係睇得好差，同埋仲有咧睇落去咧有一紮係黑色嘅，一紮睇唔到嘅。咁其實呢啲好多你近時自己可以做到嘢，或者自己做可以翻到工或者睇你嘅食藥物啊，全部係影響晒。
And apart from affecting the patient himself, and also can affect the economy personally and also to the society.
因為你睇唔到嘢啦，咁你一定揾人照顧啦，翻唔到工啦，或者食藥嘅時候我睇唔到邊藥等於邊藥嘅，好似過嚟食一隻麥科文咁，我就攞唔到喎，唔知係咪食緊麥科文咧，睇唔到蒙晒啊嘛。咁其實呢個係常見嘅問題咧，就自己照顧唔到啦，影響你生活啦，影響你亦都即係做唔到工啦。同埋咧有個即係所有嘅要用好多錢啊去幫助你呢啲人啦。咁其實呢個咧係一個常有嘅問題。我有個同學唔係有個同學嘅員工啦，就係佢就係30零歲，呢個糖尿病啦。咁佢係engineer 嘅。佢睇唔到啲線路啊，咁佢自己即係黐唔到啲線路，咁就好弊啦，叫翻工冇用。
So let's talk more about diabetic retinopathy.
咁所以我哋依家開始再講多啲咩叫糖尿病視膜病變啦。OK， 因為呢個係最多人常見嘅東西啦。
So this is the part that we talk about. Okay, the CMOS of the camera.
OK。嗱，呢個咧就開始集住即係注重咧，好似我哋個 lens 射落去嗰個電腦板睇嘅嘢，呢個就係我哋個視網膜啦。
So again, this is a picture of the retina to remind you. The picture of the retina. This is an optic disc, which is the beginning of the optic nerve, and this part we call it the macula, which is responsible for central vision.
嗱，我再重複講一次啦，呢個咧就係我哋個叫 retina 啦，就視網膜啦。咁後邊嗰個咧就叫做視盤啦，視盤後邊咧就有好多神經系統帶啲嘢去個腦嗰度話俾你睇咗乜嘢啦。然後咧呢度咧圓揼隊呢個就啱啱5個 mm 嘅東西咧就叫 macula 啦，就裏邊有黃斑咧就係睇嘢嘅地方啦。
中央視力就係
中央視力睇嘢係
靠佢啦。
係所有睇嘢都係由呢度睇落去嘅。
Sorry. So how common is it? In fact, it is very common. Diabetic retinopathy happens in approximately 1/3 of all diabetic people.
其實咧，我唔知你知唔知道咧，係一個好嚴重嘅東西咧。喺2011裏邊咧，即係喺歐洲啦。咁其實咧，1/3嘅人咧係有
糖尿病。
1/3嘅糖尿病人咧就有有呢個糖尿病患者有糖尿病視網膜病炎嘅1/3嘅糖尿病患病者喎。咁呢個好大嘅 number 嚟喎，呢個。
Okay, and then globally, diabetic retinopathy, it's a 6th leading cause of blindness.
嗱，其實咧睇翻咧喺全世界裏邊咧，原來糖尿病視網膜病變咧係第6位嘅，所有人盲咧喺個第6位嘅。
And then for diabetic retinopathy, some patients could have no symptom.
嗱，好多時咧，當呢個開始有個視網膜病變咧，好多時初時係冇病徵嘅，全部都冇嘅。
And shall we go through key risk factors?
Yeah, we should.
Okay. And despite no symptoms, but we know that there's some risk factors like poorly controlled diabetes, or very high blood sugar for a long time, or bad cholesterol, poorly controlled hypertension, high body mass index, meaning you're fat,
Yeah.
low levels of physical activities, and insulin resistance, age. So the older you are, the more problematic it could be, or renal disease or pregnancy.
OK， 嗱，呢樣嘢咧就我哋不嬲每個禮拜都有講過啦。咁其實咧，多數呢啲嘅病人，糖尿患病者或者呢啲前期患病落去嘅時候咧，好多時咧，當佢變咗糖尿病啦，佢就唔會有一個好嘅糖尿病嘅控制啦，血糖好高啦，咁佢變有一個長期嘅高糖嘅喺個血管裏邊啦，仲有佢嘅呢個膽固醇一路好高啦，咁同埋咧佢亦都有血壓高啦，同埋佢好肥啦，呢個body BMI 過咗30啦，仲有咧就係佢哋好少做好多嘢，就成日瞓喺度，同埋仲有咧好多係呢個胰島素抗拒啦，同埋年齡啦，因為年齡高咧就更加多呢個容易發生嘅，仲有腎病。所以其實呢幾樣嘢咧，全部即係嗰個危險性咧，全部就係不嬲講開呢啲咁嘅點去防禦呢啲東西啦。喺糖尿病裏面。
So a brief introduction of why it happens in the eyes, the pathogenesis of diabetic retinopathy.
嗱，咁我依家今次咧就開始逐步咧講講，咁視網膜病變嘅原因啦。
So it's mainly again the vessels are affected, and in the eye we have a lot of capillaries. So the capillaries are literally damaged in people who have poorly controlled diabetes. 嗱，
其實咧，第一好重要咧，我哋眼裏邊有好多微絲血管嘅，但係當你有糖尿病嘅時候咧，呢啲微絲血管好多時咧就被損壞，因為太多糖喺裏邊同埋有好多不同嘅地方，令到啲糖咧係真係令到個血管係壞咗，唔健康。
And then when the vessels damaged, it will leak, and so it could lead blood, it could lead fluid, it could lead the contents within the blood, say cholesterol.
當你嘅血管係已經壞咗嘅時候咧，咁佢就會開始咧就漏啲血啦，或者漏啲水啦，亦都可以漏咗咩啊膽固醇出嚟啊。
So when we talk about diabetic retinopathy, we can classify it into a few types, depending on the severity.
咁其實咧，如果你講係糖尿視膜病變咧，可以分4大類嘅。
So hopefully there will be no retinopathy.
嗱，當然啦，第一就希望你冇呢樣嘢啦，冇呢個視膜病變啦嚇。
And then for milder type of retinopathy, we call it non-proliferative diabetic retinopathy, 非增殖性糖尿病視網膜病變。
OK， 呢個係第二樣嘢啦，就非增殖性嘅。
And then for more severe type, we call it proliferative diabetic retinopathy.
咁呢個咧第三個咧就係增殖性嘅視膜病變啦。
And then one particular type could happen in both NPDR, non-proliferative, or proliferative DM retinopathy. It's the type we call it diabetic macular edema. OK， 最嚴重㗎啦，就係糖尿病再加黃斑水腫啊。咁就喺個 macula， 即係嗰個中間嗰度咧係腫咗，係。 So this is a picture showing non-proliferative diabetic retinopathy.
咁呢個咧就係第一個相咧，就係如果佢唔係成日有增長嘅糖尿病嘅輕微咧，咁就變咗就係好似咁樣啦。裏面有啲咩喺裏邊㗎？
Right, so we go through the picture a little bit. Okay, you see the vessels. Obviously, it's very different from the normal picture that we showed you early on.
嗱，其實咧呢張相已經同第一次張相咧，你見到眼裏邊係好乾淨嘅，冇血管周圍飛嘅，亦都冇好多黃斑嘅。但係呢個咧，你睇唔睇到啊？好多微絲血管走咗出嚟。亦都好多黃斑喺度，亦都有啲好似流緊血咁喺度就喺左手邊嗰度行。
This points to we call it microaneurysm, or we sometimes we call it dot hemorrhage.
OK， 嗱，呢個第一個咧睇到好多紅點咧，就呢個係咁出血啦。你睇下紅點啊，喺個指嗰度。
There are bigger patches of hemorrhages. We call it blot hemorrhage.
嗱，亦都有大塊嘅流血啊，咁啊嗰度亦都睇到好多紅色嘅，因為喺笪笪咁流血啦。
And then we see this yellowish thing, we call those exudates. These are literally lipids leaked out from the vessels.
咁亦都你睇到黃點嗰度咧，就係你嗰啲膽固醇咧係咁流出嚟，所以變咗黃色嘅。
So this is a picture showing proliferative diabetic retinopathy, PDR.
咁嗱，呢個咧就講及咧係一個視膜係增殖性嘅視膜嚇，咁就睇下佢裏邊有咩啦。
And then you see on the left-hand side, you see this bunch of haphazard, abnormal vascular net above the optic disc.
嗱，因為好得意咧，當佢唔夠氧出緊嚟嘅時候咧，即係你個視網膜缺咗氧咧，佢就會個身體咧就話我哋生堆即係嗰啲血管出嚟，去保住個眼球啦。咁但係好可惜咧，啲血管咧全部都唔係咁即係正常嘅血管啦。咁就算好多啲嘅微絲血管走出嚟，你睇到生女生龍，係啦。
So this is on the disc. We call this NVD, neovascularization of the disc. And then you see these abnormal vessels can also happen elsewhere on the retina. Mainly they're related to retinal ischemia. There is not enough oxygen, not enough nutrients to the retina. The body tries to compensate when these new vessels are not normal vessels.
OK， 你睇右手邊咧嗰啲血管咧又係周圍飛，因為佢唔夠氧咧，咁佢個身體就話喂，我真係整啲血管出嚟俾多氧咧。其實啲血管咧全部咧都唔係好嘅血管出嚟嘅，所以變咗就周圍去飛啦，亦都唔係好嘅血管，所以變咗嗰啲血管對個眼係冇作用嘅。
And these abnormal vessels are prone to bleeding. So you see there's hemorrhage within the eye. These on the left-hand side shows bleeding.
你知道嗰啲血管，因為佢唔係完善嘅血管啦，咁係好多機會咧就會流血啦。你睇上下流咗好多血，紅色嗰度睇啦，上面下面就更加流得更加多啦。
And on the right-hand side, these abnormal vessels often come together abnormal fibrous tissue proliferation.
嗱，仲有一樣嘢咧，嗰啲右手邊嗰邊咧，好多血管咧，因為佢唔完善啊，咁就令到好多 fibre 出嚟，好多即係血塊走咗出嚟，咁令到佢咧纖維膜啊，因為咁做出嚟，咁變咗嚟講咧，佢就令到個整個血管你睇到好多纖維膜一條血管，咁呢啲係唔好嘅，因為點解咧？第時咧，你會喺嗰個擺咗喺度嘅時候，有好多 cholesterol bury 喺裏邊啊，血塊 bury 喺裏邊啊，變咗就令到佢一個好大問題。
主要個 traction 啊，嗰個纖維膜咧係可能會收縮，跟住拉到視網膜脫落，好似呢度啦。So there could be tractional effect from the abnormal fibrous tissues, and they will literally pull off the retina.
因為嗰個纖維膜咧係有好多啲fibre 啦，咁佢會一路係咁增長嘅時候就令到嗰個有可能就令到個 retina 都脫落甩咗，因為佢 push 咗出嚟啊，扯咗出嚟，呢個pull 落扯出嚟。
So this picture shows diabetic macular edema.
咁亦都呢個睇到咧就糖尿黃斑水腫啦。
So this is the center part of the retina.
嗱，你睇到呢個就係啱啱所講個喺個黃斑嗰度嗰個區域啦嚇 ，OK。
See abnormal deposits at the macula.
OK， 你而家喺 macula 嗰度咧，你見到有好多不同嘅嘢已經纖維擺咗喺度㗎啦，黐咗喺度啊，係啊。
So we need to prevent diabetic eye disease.
咁第一樣要做啲咩咧？就要防止有咩叫 diabetic eye 嘅防止個叫做幫助糖尿病眼啊，係。
So obviously we need good diabetes control and also hypertension and lipid control.
其實最重要咧就係真係要降低同穩定血糖啦。第二注意食啦，因為其實咧食係好緊要㗎啦，即係你食咁多卡咧，更加血糖令到佢血管又多啲血糖啦。咁第三咧就要一定運動啦，同埋仲有咧唔好抽煙啦，食你藥啦。咁當然啦，飲去糖就真係有幫手嘅。
Right. So yes, if you do enough exercise, in fact, it's as good as one medicine.
其實如果做運動咧，好似你食一個藥一樣嘅，因為有多運動咧，你其實係幫助你個控制血糖、降低血糖。咁好似唔係食藥一樣，因為其實亦都係降低你磅數啊，記住。
So in terms of monitoring treatment, so we will advise everyone who is newly diagnosed with diabetes to have a comprehensive eye examination.
嗱，其實好重要咧。你係每一次咧都有一個好全面嘅眼嘅檢驗，咁就知道你係咪有糖尿眼嘅問題啦。
And generally, if we don't see diabetic retinopathy at the comprehensive eye examination, we would recommend every yearly exam, 1 to 2 years max, to have another comprehensive eye examination.
如果你係糖尿眼嘅話咧，
冇糖尿，
如果冇糖尿就1年啦，每年如果冇糖尿就1年去踩一次檢驗應該係咁。如果有糖尿眼就每6個月應該睇。
If it is mild，如果好輕度嘅，if it is mild diabetic retinopathy, approximately every 6 months we need to see do a comprehensive eye examination.
如果你係輕微嘅糖尿眼咧，你每6個月咧都要驗一次眼，全面嘅驗一次眼。
And if the doctor has any other concerns, then the frequency of examination may differ.
當然啦，每一個眼科醫生都會睇咗之後係去覺得你應該要做啲咩， 去決定你嘅即係有咩覆診啊，同埋有咩要注意啊，同埋點樣 treat 你啊嚇。
And an important thing is do remember to follow the follow-up schedule.
嗱，好重要咧，睇完之後咧，醫生會話咧，嗱幾時就再翻嚟。咁呢個係好重要咧，繼續去即係 follow 呢個 instruction。我講個古仔俾你聽下，呢個真實古仔嚟嘅。咁我有一個客人啦，咁佢個一個員工就係30零歲嘅啫。咁佢話有冇搞錯？30零歲冇糖尿嘅。咁醫生話你一定要過嚟睇喎，但係佢過咗1、2年都冇翻去睇醫生，最後第3年咧，佢眼已經開始蒙咗，睇唔到啦。
係 miss 咗。
So it's very interesting. I tell you a real story. This is one of my clients. He's very young, 30-something years old. He says, "Sorry, I cannot be. I'm so young, cannot have diabetes." And so he don't believe it, and he still drink a lot of bubble tea every day. And in 3 years, his eye is totally blurred, cannot see.
So again, this is one could be the signs of diabetic retinopathy and diabetic macular edema, that vision can be blurred in various ways.
呢個咧就睇到頭先所講咧，其實你個視覺咧模糊咧係可以做到好幾個唔
同嘅表現啦，
表到唔同嘅表現。第一可以蒙啦，第二個顏色唔妥啦，唔係鮮豔啦。第3一笪笪黑色啦，睇唔到啦。第4咧就直情彎彎曲曲咁，好似嗰個電腦出現嘅好多時嘅問題啊，好一式一樣嘅。
So especially for the bottom 2 pictures, it's quite common for people who have macular problems would complain of patchy blurring and seeing distorted images.
嗱，呢個咧最多人有呢個問題嘅時候咧，喺黃斑有問題咧，就係會一笪笪全部變咗黑色，同埋咧亦都喺睇片咧係變咗形嘅。咁呢個係常見嘅黃斑嘅問題，黃斑眼嘅問題應該講。
So at a comprehensive eye examination, of course, you have your visual acuity checked.
嗱，當然啦，當你去睇視力測驗嘅時候，佢一定揾呢個視力測驗個測俾你睇，睇唔睇到即係啲細字大字啊，咁知你個睇到嘢係正確幾多。
And then also for specific checking of macular functions, we would ask the patient to use an Amsler grid to check the central vision to see if there's any distortion, like the bottom chart.
OK， 嗱，亦都你去測驗嘅時候 ，before 你睇即係遠視近視嗰啲啦，咁仲有一個叫荷姆斯方格，即係 Amsler grid。咁呢裏邊咧就其實睇裏邊咧，你係咪可能夠可以好針對性嘅睇到中間嗰度有冇不同嘅歪咗啊？係咁樣嗰一點係變咗歪咗咧？咁你其實就真係去做唔到 focusing 啦，咁呢個就真係有個問題啦，喺呢一點嗰度啊。
Yeah, people with macular disease often have abnormalities.
如果你有黃斑眼嘅話咧，你個圓林隊嗰個黃斑嗰個地方，如果你有依個問題咧，你一定會有依種嘅情況出現，就係眼咧係嗰一點睇唔到係歪嘅。
So other examinations at the eye clinic, the slit lamp examination on the left-hand side, to mainly to see the anterior parts, so like the cornea, the lens.
OK， 咁你多數去睇眼科醫生嘅時候咧，你亦都會用一個叫烈光嘅燈去檢驗，就睇你個眼嘅視膜嘅 lens 啦、表現啦，裏邊嗰個lens 係點樣啦，就晶體點樣啦，同埋有白內障啦，仲有係睇到你個 macular 裏邊都係呢個睇㗎嘛。
A little bit.
咁睇到咁就睇呢隻眼裏邊有冇咩，同埋裏邊有好多血管啊，係咪亂晒龍啊嗰啲就喺呢度睇啦，係咪啊
？See a bit, okay. Mainly this is to use the left-hand side, the slit lamp for the surface examination, and maybe the lens. 睇角膜啦，睇有冇唔正常血管啦、虹膜度啦，同埋睇下個晶體啦，有冇白內障。
Okay.
So on the right-hand side is some ways that we can measure the intraocular pressure。
隔離右手邊嗰個咧就睇眼嘅壓力啦。你見唔見到裏邊眼有好多水喺度噶嘛？整隻眼嘅喎，咁睇下裏邊眼嘅個眼壓係幾多啦？可以度眼壓係幾多？
So this is the way we see the retina. So often we'll put eye drops to dilate the pupils.
OK， 好多時咧，我哋就喺呢個眼裏邊咧，就第一就將個眼球放得大啦，
瞳孔放大，
瞳孔放大啦，咁就睇裏邊眼底嘅測驗裏邊，咁呢個咧就睇到個眼膜係點樣啦。
視網膜。
視網膜係點樣？
So yeah, after dilatation, the doctor may examine you clinically with different lenses, or we can take pictures to document the findings.
OK 嗱，睇呢樣嘢嘅時候咧，好多時你醫生亦都睇下你用不同嘅鏡去睇你啦。仲有依家最好咧，就可能夠影咗你嘅相，你隻眼係點樣？咁其實依家好多時咧影眼嘅時候咧，你就知道嗱，我今日係咁，2年後個眼係點樣？咁你就可以翻睇，話有冇轉變好大咧？咁呢個係一個好重要嘅東西嚟嘅，咁眼醫生就同你睇到㗎。
So we can use serial imaging to document or quantify the disease process.
咁亦都我哋用掃描啦，用眼底嘅照片啦，睇翻裏邊嘅血管係點樣樣啦，咁能夠令到咧知道咧裏邊隻眼係發展成點啊。
So on the left-hand side is the color fundus photo, which shows the retina.
咁亦都你睇到咧左手邊咧睇到個視覺膜啦，咁裏邊咧就有好多不同血管啦，同埋佢個情況點解黃色嗰啲係
exudate。
咁你都睇到其實你睇到咧黃色嗰啲咧就係嗰啲滲漏出嚟嘅血脂同埋咧水啦，同埋仲有一樣嘢膽固醇啊，同埋紅色一點點咧流血嗰度咧就流血出嚟嘅呢度嚇。
So on the right-hand side, this is a cross-section scan of the retina. We use this machine is called this technique is called optical coherence tomography. 眼底掃描。
Okay. Also at the right-hand side, you will see 眼底掃描啦。咁呢個咧係一個睇到即係隻眼視網膜嘅橫切面。視網膜橫切面係啦。Okay.
So this is the macula. This hill-like is a very swollen retinal tissue.
咁你睇到咧，好似個山咁啦，即係知道話嗰個視覺膜咧係腫咗啊，所以變咗個腫即係個山咁。咁呢個咧就係橫邊嚟睇咧，咁你睇到哇係咪真係腫啦？原本咧係平嘅，但係呢個腫咗啊。
So and then in the center, there's a picture of fundus fluorescein angiography. 血管造影。So it's done. That we inject some dye into the blood vessels, and then we take many pictures of the eye to check for abnormal vessels.
咁亦都咧，我哋喺有一個fluorescence 即係血管裏邊咧造影啦。咁我哋放啲液體裏邊咧，就睇到嘅時候咧，所有血管睇晒，咁就知道咧佢有冇將佢
有唔正常，
有唔正常啦，血管有唔正常啦，或者係好腫啊，咁呢啲全部係睇到嘅，呢個全部係掃描裏邊睇到嘅。
So if we see significant diabetic retinopathy, there are various treatments available to control the diabetic retinopathy so that it won't progress to advanced disease.
所以咧，其實好重要咧，就係早啲睇，早啲醫，因為我哋可能如果你唔係差嘅咧，我哋第一可以用激光或者一啲咁嘅醫療系統咧，幫助你咧控制到呢個視膜嘅病變。
So the methods to control or treat significant diabetic retinopathy include laser or intravitreal injection of medicine, or even surgery.
OK， 其實咧，呢個係如果你有即係糖尿病嘅視膜病變咧，係可以有得醫嘅。最緊係早啲去睇。醫咧，第一就係可以用極光去醫啦，第二咧就可以注射一啲藥物喺裏邊啦，能夠控制到佢嘅病變嘅情況啦。第三可以做手術啦。
So we'll come to summary. That there are many forms of diabetic eye diseases, and the most important and the commonest form of diabetic eye disease is diabetic retinopathy, and it is a potentially blinding disease.
嗱，其實依家我哋講咁多嘢啦，咁大家都開始了解。第一，我哋其實有好多不同嘅眼嘅糖尿病嘅疾病，但係最多普遍咧就係糖尿病眼個視網個病變。咁但係呢個咧就係最壞咧，係好多時咧就令到你係會盲嘅，所以呢個唔可以唔重視。
So the most important is prevention.
嗱，其實最重要咧，最後啦，就係點能夠防止呢個糖尿病嘅眼病咧，就係去降低血糖啦。
To control your diabetes, to control the hypertension, and to control your blood lipids, and to have proper dieting and do exercise, quit smoking, and if you need medicine, and take your medicine, adhere to the follow-up schedules.
其實咧，好重要點降低血糖咧？第一就真係要降低你嘅血糖啦，可以能夠減嘅注重你嘅食物啦、運動啦，同埋你穩定你血糖之後咧，仲要唔好抽煙啦、食你藥啦。當然啦，係真係可以一樣幫到你，就飲個去糖茶啦。因為好多糖友都係飲咗之後降低 A1C 啦。咁其實咧，你控制血糖咧，你所有眼啊其他疾病咧都係可以幫，即係眼嘅糖尿病眼咧都係全部咧係幫你控制到嘅。咁現在我個講座咧就完咗啦。咁現在嚟講咧，就要真係問下各位朋友咧，有冇咩嘅問題？嗱，首先我就俾我哋個sorry 我寫緊碌佢先。咁我哋就俾我 email address 俾你啦。咁你或者可以有咩事嘅時候咧，可以問我哋問題啊。咁我亦都可以答翻你先。OK 得。嗱，依個咧就係我個 email address。咁你亦都可以亦都 WhatsApp 俾我嘅。因為有啲人就中意去做 WhatsApp 啦，唔緊要，我哋做 WhatsApp 俾我，咁我亦都係答咗你問題。嗱，我現在咧講完晒之後啦，I right now we have some time to answer all your questions, so feel free to ask questions. And certainly a lot of people say, wow, it's not so easy to understand. Don't worry. If you have registered correctly, we will actually send you back the slides and today's lecture by YouTube. You can reread it and re-listen to it, so you will not get lost. And certainly, if you have a question not certain, ask me. I could help to get Dr. Yeung to answer your question. So, is there any questions right now? We're open a question now. 各位堂友唔緊要。可能今日講嘢係會深奧咗啲，但係冇問題。我哋可以有咩問題咧？你可以現在問我，或者你諗過之後點問咧，我哋都可以答你嘅。咁咧就有個 question 啦。How fast does diabetic affect the eye？ 有個問題咧，如果你係糖尿患病者嘅，要幾快咧，令到你隻眼咧已經有糖尿眼咧？呢個第一個問題。So can you answer, Dr.
It really depends. It very much depends on how well the diabetes control is. But generally, if it is very well controlled, the first 10 years may be okay. But then, because some people didn't know when their blood sugars would not know when their blood sugars started to go up, and it was incidentally picked up. So these patients might have diabetes for a long time, but it was just undiagnosed. So some people already had bad diabetic retinopathy at diagnosis. So it's hard to really answer the question, how fast does it affect the eye?
Would it be somewhere that's 5 years? Do you think there'll be potentially have that issue? 5 years. Can it be 5 years? Is it that long? I mean, I think they have a benchmark they are able to have some idea of what will be the benchmark time?
Put it this way, if it is 10 years of diabetes, more or less a lot of people have some degree of diabetic retinopathy. If it's
10 years.
yeah,
Okay.
even if it is well controlled, but if it is very mild, then we can watch it for a long time. But if you have bad diabetic control, then it could progress extremely fast. In fact, some people, they even present with very bad, like they lost vision in one eye, and it's the first instance that we diagnose diabetes.
Okay, so 10 years most likely.
It is very, very well controlled.
Well
But 10 years,
controlled, most
more or
likely.
less, you will have some.
OK， 嗱，阿楊醫生就講啦，佢話如果你係大概10年咧，嘅糖尿患病者咧，
多多少少
咧都有啲咁嘅問題咧，係糖尿眼出現嘅。最大嘅問題咧就係呢個糖尿眼咧，就係呢個糖尿嘅視膜變病變啊，呢個就最 common 嘅病變啦。咁你睇到啦，頭先咧講係1/3嘅糖尿患病者咧都有呢個問題，所以變咗嚟講咧就可以即係你講得為即係呢個係，所以講得為咧其實都係。OK， 嗱你可以睇到啊，呢個 slide 咧1/3嘅人係糖尿病嘅，都有呢個視膜病變嘅。咁1/3個糖尿病啊，其實喺嗰個歐洲咧有52個 million 嘅人咧，5200萬嘅人咧係有糖尿病，係1750萬嘅人咧係已經有呢個視膜病變嘅。咁所以其實你話幾多人有啊？其實好多人有喎，所以10年就應該有㗎啦。
Well, another question. Can you recover from diabetic retinopathy? Well, it's a good question. Recover.
我講俾你先。
Okay.
另外一個 question 咧就話，如果我已經有視膜病變，會唔會好㗎
？If it is very, very mild, it may disappear.
OK， 如果係好輕微嘅，呢個係會改變到嘅，就會係能夠幫助佢係好翻嘅。就係點好翻？就係要 laser 啊。
No. Even with good blood sugar control, it may revert if it is extremely mild. The features that we see, put it this way, the features that we see, that's signs of diabetic retinopathy, may revert, may disappear. But does it mean that the vessels are totally normalized? It's often not the case, but that we don't see the bleeding, we don't see the leakage in those very mild cases. That it can go back to normal looking retina.
OK， 嗱，好簡單，阿楊醫生講得好清楚啦。最緊要第一樣嘢咧，就控制血糖。當你控制到血糖，即係由你嘅普通 A1C 係由7-8去到6點幾咧，咁你血糖已經好 improve 之後咧。咁其實咧，你嗰個視膜病變咧就可以好翻，因為佢變咗咧，佢冇咗咁多糖嘅時候咧，你個血管咧又唔會係亂咁生啦，又唔會有 leakage， 唔會漏出嚟啦，又唔會流血啦，嗰啲脂肪又冇流出嚟啦，咁所以所有東西咧都可能會好翻嘅。咁呢個係即係輕微，即係初期先啫嘛嚇。
And if we see that with very good control of your blood sugar, even if it does not go back to normal, you may stay as mild disease for a long time.
Mild disease for a long time. What is a long time? Like
years.
Years meaning 10 years?
Maybe.
Okay. 如果咧即係唔係嚴重嘅，係中度嘅，咁其實咧你可能都會係喺10年裏邊咧都係差唔多幾多嘅啫，10年啦，講10年。But during the time of the mild will be the thing as the same is also is an issue where they cannot see or they have sign and symptom or what happens.
They may or may not have sign and symptom. Depends on the on the position of the part of retina being affected.
OK，咁呢10年裏面，就算係中度咧，如果你係嗰個視網裏邊咧受影響嘅地方係睇下邊度受影響啦。如果你受影響嘅地方唔係好差啦，外圍視網咧可能冇症狀，咁就冇乜症狀出現。但係如果唔係咧，就會症狀。OK，now another good question is there a specific medication for the eye to control the effects of the diabetic? Does the eye drop help? 即係話，如果有咩藥物咧，令到呢個病人有呢個視網視網病變咧，可唔可以用啲藥物去醫啊？或者食咩就用啲 eye drop 係咪得啊？即係眼藥水啊，得唔得㗎？Eye drops.
Eye drops first. Eye drops. There's in fact no eye drops specifically made to control diabetic retinopathy. At least not at the moment. But if you already have glaucoma, in that case, glaucoma people will need treatment or long-term treatment to control the glaucoma. So a lot of times it could be eye drops.
Glaucoma. OK， 嗱，如果你係有青光眼嘅，咁呢個咧反而咧就有藥水咧係滴咧係幫助你個控制嘅青光眼，令到你嘅眼裏面嘅所謂嘅壓力咧係降低。但係如果你係唔係青光眼，係視網病變咧，係冇藥水係幫到你嘅。
And then apart from eye drops, there are drugs to combat the effect of diabetes. Well, if you have significant, because I didn't cover this part because it's too complex, the treatment part. So we talked about that we screen because when we picked up disease, we can control it. So there are ways to control diabetic diabetic retinopathy. So we talked about this, yes. We can use laser and medicine, in terms of medicines. Nowadays, for diabetic macular edema, a lot of time we inject medicine. It's a vascular, anti-vascular endothelial growth factor to hopefully we can revert the swelling of the retina. So in this way, yes, they're medicine, but this is not a drug that you take by mouth or something.
OK， 嗱，其實咧，如果你係有視網病變咧，係有得醫咧，第一就用激光嚟醫啦，另外咧就係要射啲藥落去咧喺個眼個球裏邊，咁就打入去嘅。咁呢個亦都係幫助啲血管咧就生翻好啦，因為佢啲藥咧係幫佢啲血管係翻啱嘅，翻即係正常翻佢嘅血管裏啲血管啊。咁呢樣嘢咧係，但係呢個就唔係你滴眼水啦，呢個係你真係醫生要幫你做嘅東西。OK。
Two questions.
Okay, there's another 2 questions here. What is the normal blood sugar for whom with diabetes, which is causing your eye disease? Yeah.
Normal blood sugar is really depends on your lab, okay? Because different labs, there will be lab tests to check your blood sugar and also the blood glucose, fasting blood glucose, and also HbA1c. And so, because different labs have a different reference values.
But I can actually help to answer that. A lot of people, especially in Hong Kong or even in the States, the same thing. You don't want your A1C. First of all, if you're pre-diabetic, your A1C is 5.5 to 6.4. That's pre-diabetic. Once you're over 6.4, 6.5, you're diabetes. But by the time you get to 7, you are considered a true, very beginning of diabetes. You don't want to get anything over 7 because they're going to start getting medication. 7, above 7, your doctor definitely will give you medication. They want you to drop below 7 or between 7 and 6.5. So the more important is really understand what is the A1C, because A1C is a 3 months basically average blood hemoglobin, the sugar molecule attached to the hemoglobin. Is like a protein, so you know what is the percentage. So right now in all diabetic medication, diabetic doctor will basically look at what is your A1C. So you don't want to have anything over 7. After 7, definitely get your medication. Now, if you continue to go up, they will just get, if your A1C is continue to be 8, 9, 10, doctor will give you more medication to lower A1C. Now, if you do one thing is like, I'm just going to put my finger every morning, fasting blood sugar, you only see yourself 1 point, it will not be accurate. So net result, the more important is you have to make sure that after you eat 2 hours, what is the blood sugar is going to look like, and besides your just a fasting blood sugar. So make sure when you see the doctor, you ask for A1C。我講一次中文啊。So really 仲有啦，其實每一個病人咧好重要咧，好重要啊！一定要知道個血糖自己個 HbA1c 係乜嘢。嗱，知道如果你前期患病者咧，你本身咧係5.5後至6.4咧，你就係前期患病㗎啦。過咗6.5你係糖尿患病者，過咗7咧，醫生就一定俾藥你食 A1C。如果你繼續上去咧，個醫生咧就會俾多啲藥你食，所以變咗嚟講咧，你一定要控制你血糖。點控制血糖啊 ？A1C 啊，就係第一 diet 啦，即係你控制你食嘅東西啦，做 exercise 啦，你運動啦，唔好肥胖啦。咁仲有咧就係繼續 track 你嘅血啦，因為你其實糖尿病你係冇乜症狀喎，最重要就係度下你嘅自己嘅血糖。咁知道係咁咧。咁本身嚟講咧，你就會知道晒我依家血糖幾好幾高啦 ，OK？ 咁另外仲有一個 question 啦，testing fasting blood sugar, which is more accurate the testing, glucometer, manual testing, laboratory testing, OK？ 喂，另外依個 question 咧就好嘅，依個多謝Pickle 問呢個 question 啦 ，it's really good. I'm going to answer in English first.Then we'll answer in Chinese. Pickle asked the question, is the testing of fasting blood sugar, which is more accurate in testing, or you go to the laboratory? Now, testing of the fasting blood sugar is only give you 1 point, which is the time where you are at that time. Actually, you didn't eat, but it didn't tell you the whole story. The more important is really understand what is your blood sugar has to be after you eat within 2 hours did your blood sugar go down. So that's why the doctor now all moving to HbA1c. They give you a 3 months testing to understand, and that has to be done by a laboratory or taking blood sample to test HbA1c. So if your A1c is over 7, that means you really need medication lower down. Now we have a lot of patients now using our Lowsutea.Literally have them lower the A1C, so net result they get less medication or they don't even need to have the insulin. We have many examples like that already. So important is check your doctor to give you a test called HbA1c. If you forget, you ask for A1c, they all know. So the laboratory is definitely more accurate. It gives you a free whole picture. Now many of my clients also here.will use one of these things called Abbott Libby. And Abbott Libby is a little gadget here that measure blood sugar. Like for example, I don't have to pick myself. My blood sugar is 5.5. Sorry. You notice my blood sugar is 5.5. You see? 5.5. Okay. And I will basically ask 24 hours. I see myself, what is my blood sugar? I give you graph, give you average blood sugar, estimate.And you can really easily tell if I eat a bun, bread, I will know my blood sugar goes up. So from then on, I stay away bun and bread. I only eat the stuff that is low carb, help me control my blood sugar. So a lot of my clients are now using this. It's very good. I don't have to put myself. I know myself now is 5.6. OK， 嗱我講埋中文先啦。第一，因為齊啲問題咧問得好啊，唔該晒 Pickle。佢問如果係用一個空腹血糖如果係度嘅話，係咪會好過喺呢個血檢驗室去度嘅抽血出嚟度啊？ 其實抽起出嚟度咧係度咩咧？係 HbA1c。嗱，當然而家醫生好多時咧唔係淨係度 HbA1c，仲係度埋你嘅 cholesterol 啊，知道你 cholesterol 幾多。咁 HbA1c 就係3個月嘅 average 嘅 blood sugar， 3個月嘅。咁其實所有醫生現在嚟講，即係現在醫生多數用呢個3個月嘅 A1C 咧，係講你嘅血糖係咪控制得好啦，因為控制唔到啦。因為其實你淨係睇一個 point 係冇乜意思嘅。其實最重要就係睇埋咧，食完飯2個鐘頭，你血糖升咗幾高，同埋 stay 幾耐。咁呢啲咧，其實你自己未必係睇到喎，除非你買咗一隻呢咁嘢。呢個Ophthalmology嘅東西咧，咁你就可以睇到晒，因為呢個度24小時嘅，咁你睇到啊，依家5.6，咁咪 OK 啦，5.6即係話依家大概係80啊，唔係90幾90幾啦，咁所以變咗你係會能夠令到你知道你自己嘅情況係點嘅，咁呢個咧係現有嘅最新嘅東西去度啦，所以依家所有醫生，如果你睇糖尿病科醫生，一定問你 A1C 係乜嘢。咁就算而家所有你聽書堂友個個都希望你咧去問啲朋友，唔係問你醫生 A1C 係咩嘢？咁變咗嚟講咧，你問醫生嘅時候，醫生答咗你就知 OK 啦。OK， 咁我問咗啦。另外一個 question 啦。What test is more significant as confirmatory HbA1c or oral glucose tolerance test？ OK， 嗱兩個 test 都有少少唔同嘅。我 answer this in English first。Now, more important is both tests will give a real different answer because first you take HbA1c. Oh, thank you, Imelda. Okay. Now, very important why they take an A1C because A1C give you a 3 months average blood sugar to check you guys out what is the blood sugar in your bloodstream doing. In other words, that if your A1C over 7 or 8, they will give you more medication or make sure they go back more under 7 or 6.5. That is the target they will look at, okay? But oral glucose tolerance test is basically they give you a lot of glucose in 2 hours and find out how is your body, does it have enough insulin to handle the blood sugar. So that's how they actually understand that. So nevertheless, they will basically will give you that test to understand your body does have enough insulin handling. If you drank the glucose test, but after 2 hours, your blood sugar, when you measure, is like not 10, but 20 or 15. That means your body, that means 10 to 15 mean millimole per liter, or you make a 200 or something like that, or 300, not 200, 300. That means your body are not able to handle a lot of sugar. So net result, then they will say, well, yeah, your A1C may be still marginal, but you don't have enough insulin to work to control your sugar. So both tests give you different information. But literally, every doctor will first understand A1C first. The oral glucose tolerance test will be the second test to see if I give you a lot of sugar, how does your body handle your sugar? Basically, that is how I do it. Now, indifferent. 我講用中文嚟講啦。頭先個問題問得好嘅，多謝阿 Miller 講呢樣嘢啦。A1C 咧係每一個現在嘅所有嘅糖尿病醫生都會睇㗎啦，因為如果你過咗7咧，佢一定俾藥你食，再上去再俾多啲藥你食。咁但係咧有個叫做 glucose tolerance test， 如果俾好多糖水俾你飲啦，2個鐘頭，咁佢就睇下你個身體夠唔夠胰島素 handle 咁多糖。如果你飲完之後2個鐘頭，你嘅糖咧都喺15啊、16啊，或者喺美國咧就 milligram per liter 嗰個 deal 咧就係好似300啊嗰啲咧就話你個身體咧係 handle 唔到咁多糖，即係話你個唔夠胰島素啦，或者好多 resistance 咧就做唔到嘢啦。咁呢樣嘢咧係會喺呢個即係呢兩個 test 唔同嘅東西係講俾你聽嘅。OK， Wow, those are very good questions, by the way. Thank you very much for asking. Okay, are there any more questions at the end? Yes, there is another question. And what is the how does the laser treatment work on the diabetic mellitus?
Diabetic retinopathy.
Okay.
So I didn't go into details because I could give you one extra lecture or two lectures.
Actually, Dr. Yeung was saying that will give us part two. This is only part one. I think it's very interesting.
It's too difficult to cover everything in one lecture.
Absolutely.
Yeah, but briefly, let's say, okay, maybe I take the second question first. Okay, what is diabetic macular edema? So it's this in the screen now. See the picture showing retina, and in particular, we call macula is the center part of the retina. So all the yellowish stuffs, they are lipids and the cholesterol leaked out from the vessels. And so if you think imagine, I mean, in fact, the retina is pretty much like a wafer. You have many layers to it. So if the extra stuff within the retina, it will swell up. And if the retina swells up, then it will not it will not give a good signal to the brain, because that's why you see things blurry, because the retina does not work normally. So we don't want the retina to swell up, okay? And in particular, macula, because macula is responsible for central vision. Maybe I do it in Chinese.
Okay.
你睇而家嗰個 slide 就見到嗰個相咧，就係視網膜啦。咁視網膜咧，呢度 show 兩張相，其實都係視網膜，尤其是睇個中央嗰部分咧，好多黃色嘅點點咧，其實就係嗰個血管滲漏咗出嚟嘅一啲水啦，同埋一啲即係血脂咁樣已經漏咗出嚟㗎啦。咁視網膜同埋有血啦，係啦，嗰個膽固醇漏咗出嚟㗎啦。咁嗰個即係嗰個視網膜本身咧，其實好似威化餅咁千層糕一樣，其實佢好多層嘅。咁如果佢有水腫喺入邊咧，其實佢腫起咗咧，佢功能就唔好噶啦。咁尤其是個黃斑咧，我係黃斑區啦，其實係負責中央視力嘅。所以如果佢水腫咗咧，黃斑功能唔好咧，我哋睇嘢就會好差噶啦，因為嗰個黃斑負責中央視力啊嘛。咁所以我哋首先就唔想佢水腫啦。好啦，咁如果見到水腫個，咁點搞咧？咁我頭先講過可以打激光啊，可以打藥啦。咁我哋啱啱嗰度問題，其實打激光係其中一個方法去處理黃斑水腫嘅。So if we see macular edema, we can treat it. In the past, we treat it with laser. So maybe we take an example of the left-handed picture. Look at this ring. You see a ring of exudates.
Oh.
You see there are many rings of exudates. As if you can almost see that there's a dot in the center, and this is the abnormal microaneurysm or leaking point. Okay, so if we use laser, then we would just zap that point. Literally, we zap that point.
So they don't bleed.
Yes, so they won't leak. Okay, we close up that vessel. 如果睇黃斑水腫啦，即係其實以前我哋冇咁多方法醫咧，其實激光咧都係一個好重要嘅方法嚟嘅。咁例如我哋見到左手邊咧嗰啲一圈一圈嗰啲漏咗出嚟嘅cholesterol 啦，嗰啲膽固醇啊、脂肪啊，咁嗰一圈咧其實你都可以差唔多見到中間有點紅色嗰點咧就係唔正常漏水嗰點，嗰個即係好似個血管多咗個 port 咁樣嗰個位。So 如果打激光咧，我哋就係對住嗰個位嚟到打，直情係封咗佢，希望佢唔好再漏出嚟嘅。So there's one way we can use laser to close off the leakage point if we see these ring-shaped exudates. And if we see very bad retinopathy, like we see neovascularization, this is actually due to ischemia. The eye does not have enough oxygen and not enough nutrients. So the body will try to balance out. So one way the body will try to rescue by growing more vessels, but this is undesirable. So when we see this, okay, one way is to reduce the oxygen demand. So it may sound very cruel, but in fact it is what is done, that we use laser to destroy or kill off the peripheral retina.
Oh.
So I mean, it sounds very brutal, but this is what it is. That will use laser to destroy to the peripheral retina, the relatively not as important part of the retina. So, and then that means that you have a smaller area of retina, so there's a smaller need for oxygen, and hopefully these abnormal vessels would regress.
There's a question. The diabetic macular, the edema,
yeah.
How did it cause it? Oh, sorry.
We've taken that already.
Okay, sorry.
And then, so I'll say again for lasers for PDR. 而家你喺個熒光幕咧見到其實就係呢個唔好嗰種最即係衰嗰種視網膜病變啦，就係有啲唔正常血管已經生咗出嚟㗎啦。咁佢點解生出嚟？因為唔夠血啊嘛眼睛，咁身體想補救呢件事就生多啲血管出嚟。但係呢件事咧係唔理想，因為呢啲血管係衰嘅血管嚟㗎。咁所以我哋即係點樣平衡佢咧？咁所以當我哋見到呢個情況咧，我哋就會考慮用激光方法，其實將外圍嘅視網膜相對上冇咁重要嘅範圍咧，用激光破壞佢，其實就令到嗰個眼睛對於養分嘅需求咧減低，就希望呢啲唔正常嘅血管咧可以即係自己可以收到咯，咁就唔會生到亂晒龍咯。其實呢個係一個比較 passive， 即係比較消極嘅做法嚟嘅，但係呢個就係即係要控制佢都要犧牲咗外圍咯。咁而家嚟講咧，其實有啲情況咧，我哋就唔打激光，咁就打針，就用藥物嘅方法，即係頭先我講我可以打針入隻眼度，咁其實佢都可能可以幫助到即係呢啲唔正常嘅血管自己消失。但是如果到咗呢個程度咧，其實就已經係都幾差嘅情況啦，所以就唔想去到呢個程度咯。
Okay, good, thank you. There's one more question. It's called what is diabetic macular?
We've taken that question already.
Oh, you answered that question.
Yeah.
Okay, good. Okay, are there any more questions? If you have any more questions, you can ask now because Dr. Yeung can able to answer all your questions. Hopefully that we have provide all your questions. It's very rare to have such a knowledgeable eye doctor give us this very down-to-earth, very simple explanation. It's very hard because...
Sorry, there are a lot of... Yes, one person commented there were many terminologies, but yes, I agree that there were many terminologies, but try to
make it as simple as possible.
Simplify things.
But it's already very good because I must say, I know eye is very hard to explain, and I already actually reviewed with Dr. Yeung several times how to make it as simple as possible. To me, this is very simple, easy to understand with a lot of picture, so help you to really able to grasp the idea. But Dr. Yeung also promised that we'll give a lecture 2 to basically further enhance our further education, but will be future months. But I think it's really wonderful to have at least now understand, because don't forget, 1/3 of diabetes mellitus people do have diabetic retinopathy. So that can be a very serious thing, which you need to alert yourself early, so get to the doctors early to check it out. 今日好多謝咧我哋嘅楊醫生啦，咁夏威夷啲人話mahalo，即係話多謝你啊！我哋今日嘅講座啦，亦都講得好清楚啦。咁我都其實同阿楊醫生即係講咗好多咧，點能夠令到更加 simple 啦。我諗楊醫生都好啊，有一晚佢做1點幾鐘做呢個 slide， 令到啲嘢更加清楚、更加形狀。1點幾鐘啊，1點27分我記得，1點27做呢個 slide 真係好難得啊！特別為呢個講座咧，講啲嘢係好容易 understand 嘅。咁變咗嚟講，你要知道咧，原來糖尿病嘅人咧， 1/3嘅人都有呢個叫做糖尿病嘅呢個視網病變啊，所以變咗嚟講係一個嚴重嘅東西嚟嘅。咁所以變咗，如果你唔知道咧，就以為冇乜嘢啦。好似我個堂友咁3年，佢隻眼毛，其實可能佢已經有一段時間，不過佢唔鬼知啫。佢只係自己話冇乜嘢啦，係咪近視啊？佢最弊佢以為自己近視，其實唔係，就係嗰糖尿病㗎。咁但係3年佢就已經開始係咁啊。但係嗰啲係咪可以改變到嘅？即係如果佢依家近視嗰啲，即係佢話近視啦，其實唔係啊。
佢可能唔係近視啦。唔
係近視啊？係咪可以轉變到嘅？如果佢係做到呢樣嘢？
如果佢睇嘅真係好，因為真係太多嘢可以令到佢眼矇啦。其實而家講翻轉頭都唔知佢咩事㗎啦，都係要即係唔好拖啦。大家講真，即係如果你覺得唔妥嘅，就唔好以為冇嘢咯。係啦，都要去認真處理，去詳細檢查下。
So very important, according to Dr. Yeung, is that you really have to look into it, and now you give you this knowledge base to better understand what is diabetic retinopathy, so you can start looking into it. And if there is actually occur, you should get an eye doctor to really check it out. Don't delay because it doesn't worthwhile. Because just like my client friend, missed the appointment, 2 years, don't do anything, cannot see nowadays. Okay, so thank you very much. I appreciate your time. I know you guys are busy. Saturday afternoon, and in Hawaii it's Friday, almost 11 o'clock, and also to US and for Philippines, Singapore, Australia, they all become to be late. But I really appreciate you share the time with us, and our heart is to help you to delay your diabetic onset for the pre-diabetic patient. And if you have diabetes, we don't want you to get more serious diabetic. And so Lowsutea will help you to lower your blood sugar, improve your A1C. So continue to be trying hard, do your dieting, your exercise, losing your weight, listen to our webinar, more, know about how to prevent better, diabetic. And then last but not least, measure blood sugar. Thank you again.
Welcome. So if you've got more questions, you can find Andrew, and Andrew will channel the questions to me.
Okay. 如果你有任何問題咧，記住啊，嗱，我寫咗 WhatsApp 喺上面啦，個91930288，91930288，亦都我有email address 喺度嘅，我再打多次啦，咁大家咧就可以睇到，咁就可以能夠即係喺個 chat 嗰度睇到啊，呢個
Zoom
係Zoom chat 嗰度啊。咁我哋 WhatsApp 電話91930852啦，91930288啦，852呢個打錯咗喎，85291930288，sorry 啊，啱嘛，852你唔係有做多一嘅 ，OK，85291930288，852OK 啱 ，OK。嗱，如果你有咩問題咧，WhatsApp 俾我啦，919308。If you have any question, you WhatsApp me. 852 phone number is 9193-0288, 9193-0288. What's me? Or email me at andy@wahfong.com. So looking forward to hear from you. And if not, we'll see you next week on a different topic. And next week will be interesting. We'll try to do something more fun. Okay, you take care. Bye-bye.
Bye-bye.
Merry Christmas and Happy New Year. You notice our mask is Happy New Year mask.
Merry Christmas mask.
Merry Christmas. Okay, thank you. Bye-bye.
Bye-bye.